we need to understand the impact that different lifestyle factors have on our emotional state, our mood state, our psychological state. And as I discuss these, we will find that almost everything that we do has a profound impact on our emotional, psychological, and mental well being. I mean, if we do things which are unhealthy for us, it will have a negative impact. If we do things in a positive way, then the effect is always going to be positive. If we look at sleep, it's very, very important to have an adequate amount of sleep. The quality should be good and the quantity should be adequate. People who are perpetually sleeping less than what their body and mind need at whatever age of life they are in, they are going to feel the ill effects of stress, of strain, which is then going to translate into depression at some time or the other. For an adult, the average duration of sleep, which is a must, which is mandatory, 6 to 8 hours every day. If we talk about food, if we have a balanced appetite, it that balanced appetite contains all the raw materials that the human brain needs to produce the chemicals and neurotransmitters that are required for optimal brain and mind functioning. Whereas if the diet is lopsided, if it is not a balanced diet, the chances are that we will have deficiencies of one or more nutrients, especially minerals and so on, which could contribute to a chemical imbalance, which could then translate into depression. A lot of people, I think most people in this world drink, a huge percentage, they smoke. What people do not realize is the very, very harmful consequences that they're exposing themselves to through excessive use of alcohol and tobacco. For instance, where alcohol is concerned, people feel that, I mean, most people would say that, when I drink, I feel very good, I feel very happy. The fact of the matter is that it's only the first 30 to 45 ml of alcohol that you take, which actually makes you, feel euphoric or feel happy. Any alcohol that is consumed beyond this measure is a uniform depressant on all brain functions, on all psychological functions, on all cognitive functions. And so people who are habitually drinking more and more regularly, more days in a week, are more likely or are more vulnerable to developing depression. Similarly, tobacco produces a very, very transient elevating effect. It's transient because it lasts for not more than a few seconds. Otherwise, tobacco or excessive consumption of nicotine will increase your anxiety levels, will increase your tendency to get depressed. Both when you smoke and when you don't smoke, it's almost as if the withdrawal could be associated with a mood change. Physical exercise, especially aerobic exercise, is extremely important for mental well-being. When we do aerobic exercise, it causes the release of certain chemicals inside the brain which are called happiness molecules. So people who would exercise regularly, when I say regularly, I would say exercising for even 30 minutes at a time, 5 days out of 7 in a week, will produce sufficient amounts of these chemicals which we call endorphins to keep you happy, to keep you feeling contented and fulfilled. And so people who do not do this aerobic exercise, they are depriving themselves of probably the most important physiological source of such chemicals. These are some of the lifestyle factors which, like I said right in the beginning, which have a very significant role to play in determining whether we remain happy, sad, anxious, irritable, and so on. If we can, one is not saying that one should swing to the other extreme and become a complete saint. No. Try and walk down a middle path so you do what you want, but you do this in judicious amounts.